for Chini and Vidi DBH, a baby Jamoy. Your Sanko Comotia home will be the Paya Juana G. The palm of fire, when you're much sharing in Yahu. Monfania Hinch and Fatano, yet you would do whom a shame. Maboso, Jodi, a Chini Messiah. Level number two no banco, a chamako, Ojana so, a town from Betty Dame from Bezaya, Mumra Dame from Bezaya, anybody to be shed. I will for and Sapokra when in penny 40. And son and the friendly that took one and Sakuta be Miana Maya and Kodanka to a Sukono Mama Shamwama will see if
This is Z 101.9 FM, your lifestyle, leisure, and business radio. This is a derma dialogue, and I am your host, Dr. Kofi Ansah Brefo. You can also stream us live on radio.zmultimedia.com. You can also follow us on Instagram, Facebook, and X at ZFMGH, TikTok, and YouTube at Z Multimedia. On today's show, very interesting conversation. We are talking about body itching. We are talking about pruritus. So many complaints about itching, either the whole body itching, itching with or without the rash, and also very interesting myth surrounding itching as well. We also discuss the causes of itching. Very interesting. Causes of itching. We discuss why certain myths are more common. We also break these myths. Then we try to understand, in terms of investigations, what are the most important investigations that we do. In terms of treatment, how do we treat it? We allow all your questions, testimonies, reviews, comments via text or WhatsApp on 0544 321 019. So 0544 321 019. You can also call us on the same number. Today is Saturday, the 11th of April, 2026, and we are at Z. Stay tuned. We are going to be right back as we share some of the myth related to body itching. And stay tuned on quick commercial break. We will be right back. Don't change that dial. to the Derma Dialogue right here on Z101.9 FM. I remain your host, Dr. Kofi Ansabrefo, and it's time to share some very interesting myth when it comes to body itching. The first one we receive, it's all itching is due to poor hygiene. So some people believe skin itching, any type of or any form of skin itching, is as a result of poor hygiene. So not necessarily. Yes, poor hygiene can lead to maybe some fungal infections, which sometimes has an itching component, but not all skin itching or not all body itching is as a result of poor hygiene. So, for instance, you can have other causes other than fungal infection. So you can have even systemic causes. You can have itching with or without a rash. And you can also have itching as a result of certain medications. A very common one is what some people experience when we used to use anti-malaria medication called chloroquine, where people complain of severe itching anytime they take chloroquine. And some antibiotics as well. So these ones, it has nothing to do with poor hygiene. So that's the first myth we need to break. All itching is due to poor hygiene. That's a false. The second one is, if it itches, it must be a fungal infection. So many a times we focus more on the infectious causes of skin itching. We have several causes of skin itching. We have systemic causes. We have even local ones. We have generalized skin itching. We have itching with or without a rash. We have itching less than 6 weeks. We have itching more than 6 weeks. We have itching associated with water. So the classic one, you hear people say, anytime I have a shower. Initially, it starts with shower. With time, even when they sweat, they complain of skin itching. Then we have itching as also associated. Some people complain when they eat certain foods. So the classic one is the seafoods. So people will tell you, well, anytime I take my shrimps. So shrimps, lobster, octopus, prawns, they start experiencing itchiness. Sometimes it starts gradually at the lips, but with time it progresses. And it can become, the generalized body itching. Body itching is very severe and is something that we all need to have or know about, or you need to know what to do, especially when it's been going on. Persistent itchiness, sometimes yes, and sometimes it runs in the family. So I have patients who say, Doc, my mother had a similar issue, or my dad or a sibling of mine, they are also itching. And we have acute ones, we have chronic ones. So definitely, if it itches, it must be a fungal infection. It's not entirely true. Yes, there's a fungal part of body itching, which tends not to be even very itchy. So definitely we need to break this myth. Then we also have this myth. Some say hot water is very good for itchy skin. Yes, some people get a very brief relief when it comes to itching. So anytime they use or they bath with hot water, they will tell you, Doc, it calms it down. But the truth is, hot water rather makes it worse. So in terms of how long it lasts. Now, when your body itches, especially when you have a dry skin, and because of that you are itching, when you use hot water, what you are doing is, it dries your skin more, making the itching worse. So sometimes it's just like a cycle. We intend to use the hot water to calm or to get some relief from the itching, but it's just like a cycle, it comes back. So hot water, as they say, is good for itchy skin, not entirely true. Yes, you get some relief initially, but it progresses or it comes back, or it becomes even worse. So these are the three myths when it comes to skin itchiness, or generalized or even localized skin itching that we received. You can also join us. You can text us. You can send us you can actually call us. Share your experience when it comes to body itching. Body itching is with us. People have experienced body itching for a long period of time. Body itching, I have a patient who usually would take an antihistamine. And her worry is, Doc, I've been itching for a very long time and I've been taking the antihistamine. Is there any side effect of it? What happens? Should I be worried when my skin itches? Or even should I be worried when I'm not the only one who is itching? I mean, most people are itching in the family. Do we require antibiotics for all causes of itchiness? And why, when it comes to the treatment, why does sometimes it takes a very long period of time? You realize some people itch for a long time. Others too, well, they take their dewormers and they are good to go. And a very common complaint is once you are itching, anytime you itch, once you take a dewormer, it goes away. Well, it depends on what is causing the itching. So yes, we have some infective causes. We have some systemic causes. We have some, from external sources like medications as well. That's why we are here. So we are here to talk about body or generalized body itching. We've managed to break some myth. And at this point, so there's a picture you see there. If you join us, there's a picture on the screen. So this is a typical area where people itch as a result of them using certain cosmetics. So that's what we call. So typically, this one has some. It's erythematous. It's reddened. It has some redness. Then it has some scaliness as well. And it's definitely, you can tell that the patient is really itching. So this is a very common cause of itchiness, but this is more localized. So depending on where you put the perfume or where you put the cosmetic, that is where the itchiness usually will start. So yes, we need to take our time to understand itchiness. Now, another term that we use in the consulting room for itchiness is what we call pruritus. So anytime you hear pruritus, it just means skin itching. Pruritus or skin itching is not a disease, it's a symptom. So itching itself can come from your skin. It can also come from underneath the skin. So it can actually come from your nerves. It can come from the blood, or even some psychological stress as well. Now, in some cases, the itching may be the first sign of an internal disease. And that's the main reason, or that's why it's very important that we seek medical attention when we are itching or when we itch for a long period of time. Persistent itching, definitely. Now, we will take our time and break it down. A common cause of skin itching is dry skin. So when your skin is dry, itchiness definitely comes with it. And that's the main reason why we advise we moisturize our skin. Very important. Now, here in Ghana, certain conditions present with itchiness or pruritus. So we can start with eczema. Eczema in Ghana, I mean, what when we say eczema, some people refer fungal infections as eczema. But the proper eczema, that's skin irritation or people with sensitive skin, it comes with itchiness. Sometimes too, fungal infections can also present with some mild level when it comes to these itchiness. Then allergic reactions. So that's a picture that we saw. Definitely it points to the patient using some medication. So what you see there, this is a typical way of when it comes to these pruritic papules. So what you see on the screen, typically this looks like a picture of a child, and it extends from the forearm all the way into the palms. And this leads us to, so this one can be an allergic reaction from certain chemicals or certain cosmetics. Again, Sometimes certain detergents that we use or afterwash can also present with this itchy rash. Now, an infective cause that needs to be addressed is what we call scabies. Scabies is very itchy, and when it comes to scabies, it is highly contagious. So what it means is you can pass it on to from one person to the other. Most people treat fungal infections as eczema, and this worsens the condition. Now, we are going to talk about infective causes of body itching. So scabies, yes, it's a parasitic infection, and you get it by coming into contact with somebody who has the mite. Typically, the itchiness is worse at night, and they like certain parts of our body. So the itchiness tends to be worse, especially in our groin area. So in between the fingers, so interdigites, and the groin area, sometimes even in the armpit. The women sometimes under their breast. And the classic history is itchiness that is worse at night, nocturnal kind of pruritus. So this is worse at night. And the history is dark. Well, during the daytime, the itchiness is not that bad. But in the evening, I start scratching. And sometimes when you push further, you realize apart from the patient that you are seeing, there's a household member who is also experiencing the same itchiness. So definitely when it comes to infections, fungal infection, yes, some bacterial infections as well. Now, let's talk about systemic. So anytime, especially when you have a long history of itchiness, so you've done all the things. There's no obvious rash showing, and the itchiness has been there for years, sometimes several months. Definitely we need to investigate. Now, the investigation will depend on the age of the patient. So if it's a young person or if it's a middle-aged person, you are thinking more of, is it the liver or even the kidney these days? Then if it's an older person, quite like proper middle age or even an elderly, then you are thinking of malignancy or cancer. So we keep on saying, if itching is generalized and persistent, you need to think beyond the skin. And that's very important. We need to always think beyond the skin, especially when you've used all these antihistamines. Unfortunately, there's no improvement. Then we talk about medications. Some people will tell you, doc, this medication, anytime I take this drip, I get this generalized body itching. And all we need to do is to identify what causes or what triggers our body itching and avoid them. So some antibiotics definitely, some painkillers, some herbal mixtures as well. Now, we need to talk about the psychological causes. Stress. So some people's stress will manifest as itching. They start scratching. You notice there is no obvious rash. There is no change in skin color. But there is a very intense body itching. And that is what we all, this, the psychological, but the clinical psychological part of it, psychosocial. Some people, when, they are anxious, anxiety, definitely depression as well. So the skin and the mind, they are deeply connected. And that's why some people will complain of itchiness, but when you check, there's no obvious rash. There are some red flags we need to also talk about. So you need to seek medical attention if the itchiness lasts more than 2 weeks. Very important. So what you see there, yes, this is a very extensive, scaly patch. If you look at the margins, you have the scaliness. Generally, it looks erythematous, and this qualifies for even fungal infections. Sometimes we have the fungal infection, which by itself is not too itchy, but sometimes we apply all these steroids, that mask it and prolong it, what we call the tinea incognito. So definitely, anytime you see or anytime you hear itchiness, you need to ask more questions. Now, if it's lasting for more than 2 weeks, we need to investigate. Now, if there is no visible rash, we also get worried, especially when it's even associated with weight loss. So you have itchiness associated with severe weight loss or even fatigue. Then, as we said, scabies. So if it wears at night, itchiness with worsening, symptoms at night. Then if it spreads despite the treatment. So sometimes, yes, I get this a lot. Doc, I've been taking my antihistamine, I've been taking my cetirizine, I've been taking my Piriton, I've been taking my Loratadine, my Claritin, but I'm still not seeing any improvement. It used to work previously, but now there's no change at all. Now, persistent itching without a rash can signal an internal disease. Very important. Anytime there's a persistent itching without a rash, we could be dealing with a very severe, internal disease that needs to be investigated. So these are the red flags that we need to always take our time, look out for it, and seek medical advice. If you've just joined us, this is Z101.9 FM, and this is the Derma Dialogue on ZFM. We are discussing body itching. We are discussing skin itching. This is a very common complaint that we get in the consulting room. This is a very common complaint that we see or we hear all the time. And this is one of the commonest when it comes to misdiagnosed symptoms, or when it comes to we identifying the cause of it. Because we always treat the symptom. We don't treat what is causing the symptom. And that's why we are here. So you can follow us on Instagram, Facebook, and X at ZFMGH, TikTok, and YouTube at Z Multimedia as well. You can also join us. You can share your questions, your testimonies, your reviews, comment via text, or WhatsApp us on 0544 321 019. 0544 321 019. You can also call us on this same number. And I am your host, Dr. Kofi Ansah-Brefo. We'll continue with our discussion on generalized body itching. Now, you can also join us on TikTok Live at The Skin Messiah on TikTok Live. You can share your questions as well. We're going to pick questions from there. We'll discuss myth or anything you want to know about body itching. The lines are open. You can also join us. So, we want to discuss some common mistakes that we do in Ghana when it comes to body itching. Now, some people use steroid creams, or some people buy over-the-counter creams and use for body itching. And I always ask myself, where do you apply this cream? Because then the whole body is itching you. Is there any rash that you're applying the cream on? And that's one of the commonest mistakes we do. We are always applying creams on generalized body itching, even when there is no obvious rash. Then self-medications from pharmacists without diagnosis, very important. And some people apply toothpaste. This is a very common practice. Herbs as well. Or some do some organic, concoction. People also visit or use the seawater. So I've had patients who, they come to me with severe itching, and they always go to they tell me as part of the interventions, they had tried using or bathing in the seawater, in the sea. So yes, that practice is also very, very, very common. And sometimes I had one patient who tells me, Doc, they asked me to use apetishi, the local, drink for it. And I always tell them, in an attempt to you treating or you solving this issue, or you treating generalized body itching, you rather end up causing more irritations or more damage on your skin. So these are some of the mistakes that we do when it comes to it. And some people also scrap the skin aggressively with sponge. So we keep on saying the itch scratch cycle is real. The more you scratch, the worse the itching. And we always advise we rather reduce or we don't scratch that often. Now, chronic itching. So we have acute, we have chronic. Now let's talk about urticaria, wheals and hives. This is one of the commonest presentation in the consulting room. And classically, the patient tells you, Doc, I see these red bumps every now and then, very itchy. And when it comes less than 24 hours, they are gone. But it comes back. I've taken my dewormer, I've changed my soap, I've changed my creams, but I'm still experiencing this. And this is what I always say. When it comes to urticaria, we have types. We have the acute, we have the chronic. So when it's less than 6 weeks, we say you have acute urticaria. When it's more than 6 weeks, we say you have chronic urticaria. Sometimes, not only do you experience this wheals and hives that appear on your skin, some people have what we call angioedema. That is swelling of their lips, sometimes swelling of their face, or just a portion of their eye. So this is what we call angioedema. So chronic urticaria is one of the difficult things to manage because as long as you are in contact with the trigger, it goes and comes. So the most important thing is not the antihistamine, which some people, they've been on for years. I had a patient who said, Doc, I've been taking cetirizine for over 2 years. I have another one who says, Doc, me, anytime before I sleep, I don't take cetirizine. I'm not able to, I will keep on scratching. So cetirizine or these antihistamines, they've become our go-to. And instead of we investigating what is causing the itchiness, we only manage the symptom. And that's the reason why it goes and comes. So if you are listening to us, you've been dealing with itchiness, chronic itchiness, whether the whole body or certain part of your body. Or some people tell me, Doc, when I sweat, that's when it comes. Others too will say, Doc, when I pass through the sun or when the room is hot, definitely we need to find the trigger. Until we get a trigger, it's always impossible to solve this issue. Now let's discuss some simple management tips that we can do when it comes to skin itching. So chronic urticaria, definitely. Then we have chronic pruritus, or when you have itchiness for a long period of time. It ranges for so many things. So it can, depending on the age of the patient, that one will tell us or inform us which labs to do. Sometimes there's a need to do a very thorough check. We check your liver because then that's a very common presentation, especially when you have generalized itching. You have your eyes or your body turning yellow, and sometimes your urine color even changes, more like a dark urine. And some people, their stool may even change. It becomes more like the color is more like these chalkiness, or you are flashing and you see it's just like a typical oil that you're seeing. So anytime you see these symptoms associated with itching, we need to investigate. It's not just itching, but the itching is just a symptom of it. So we need to investigate. Now, in addition to all this, there are certain malignancy or certain skin cancers that present this way. Now, anytime you are experiencing wheals and hives or those redness that appear on your skin, however, your own is more than 24 hours, it lasts more than 24 hours, definitely we need to investigate. As I said earlier on, itchiness could be coming from the skin. It could also be coming from your blood. So then there's what we call urticaria vasculitis. That's a very common present. So it also appears, or it also presents with all these, wheels and hives like rash. But the difference is, it's there for a more period of time. It's usually more than 24 hours. So then we need to investigate. Then you can also have itchiness from, chronic eczema, or when you are reacting to certain creams, certain perfumes, certain detergents, certain hand creams, certain perfumes, certain jewelry. Some people, they place their, or they wear their necklace or their watch, and they are reacting. Some people are using a different or a new lip gloss or new lipstick, and they are reacting. Some people are using different or new dye, new hair dye, and it makes them react. So all these are, chronic eczema or eczema-related itchiness. Then, very importantly, sometimes or anytime you see or you hear the symptom itchiness, you need to also take your time and ask questions about, there's what we call H. pylori. So H. pylori is the same bacteria that causes stomach ulcer. Now, this bacteria is also known to, trigger or to make us itch as well, especially with chronic pruritus. So some people definitely would need to rule out H. pylori infection. Sometimes hepatitis B. That's the first time you're realizing, somebody has hepatitis B. Sometimes it can present with these generalized itching. Then infections like HIV. So sometimes you've run all the labs. There's nothing that is, coming up. But all you need to do is to run or do your retro screen or check for HIV. And sometimes you find it there. And there's a common rash associated with HIV. That's what we call the PPD, pruritic papular rash, or pruritic papular eruption. So some people, the first time you see them in the consulting room, or the first time they present with or in the consulting room, or the first time we diagnose them with HIV infection, is when they present with these recurrent itchy rash. So there's a typical history is, doc, I've been experiencing this rash, very itchy. It comes and goes all over my body. And you do that, all the tests, you're doing skin scraping, nothing seems to be positive. And you probe further, or you run the test and you realize the HIV is positive. So this tells us that itchiness, especially persistent rash, itchy rash, that goes on for a long time, it needs to be investigated. It needs to be investigated. It's not just about taking your cetirizine. It's not only about deworming, but it has to be investigated thoroughly so that you come to the bottom of it. Now, let's talk about what we do when we hear the complaints of itchiness. So the first most important thing is it an itchiness with a rash or itchiness without a rash? Then secondly, how long has it been there? Did it just start last week? Yesterday? And we need to be sure. Did you eat any new food? Or was it preceded by you taking certain medication or certain drinks? So these are very important things that we ask. Then we probe further into what exactly is causing the itchiness. We want to know, how do you get relief apart from the antihistamines? Which one really helps? And sometimes there's a need to even extend to the household members. So we ask questions about, is there anyone close to you who's also experiencing itching? Then apart from the itchiness, are there any other symptoms? Have you lost weight? Or have you noticed any white patches on your tongue? So all these are important pointers because we want to find out beyond the itching, is there anything that we need to be worried about? So these are very important pointers to triggers or two causes of them. So once we have all this, then it helps us to find out, or it helps us to know exactly which labs to do. The labs obviously depends on what you are suspecting, because you can run all the tests. First of all, you need to consider the age of the patient. Itchiness or chronic pruritus in an adolescent is different from chronic pruritus in an elderly, a 65 or a 70-year-old. So these ones will tell you where to investigate. Very important. Now, we will be going on break, but we need to, once we are back, we are going to discuss more questions, or we are going to share more light on what people do when it comes to this, and we are going to share more tips when it comes to itchiness. You want to be sure whether we are doing the right thing. You want to be sure, should we go further? You want to be sure that are we not dealing with any other any other condition? And these are the reasons why we are here. You are still on the Derma Dialogue on Z101.9 FM. Stay tuned. We will be right back. We have, we'll go through some questions, because last week, no, 2 weeks ago, unfortunately, we couldn't go through all the questions. So we start with, is it Phipps? I hope I pronounce your name right. So Phipps is asking, what are the common causes of body itching? So that's in general. So we spoke about few of them earlier, but in our setting, I will just go over it. So one common cause is what we call the aquagenic pruritus. So some people, they itch after bathing. Not only bathing, or anytime they come into contact with water, they complain of itching. So that's definitely. Then we have what we call urticaria. So these are the hives and the wheals and hives. You know, some people have these very itchy or pruritic patches or rash that comes and goes. It's usually typically less than 24 hours, it goes away. Then yes, eczema in general. So eczema, whether you are eating something, whether you came into contact with some chemicals, some dye, some pomade, some perfume, some jewelry, So yes, eczema definitely. Then infectious ones. So the infective ones are the scabies. Fungal infections can also present with pruritus, but it's not as common, or the pruritus is not as intense as the eczema one. And at this point, we need to differentiate the difference between the proper eczema and tinea infections or fungal infections. So these are some of the causes. And FEBs, we can also have it from medications. So some people, when they take certain antibiotic, cephalosporins and stuff, they tend to itch. So, and then food. We need to talk about, especially with the seafoods, the shrimps, the lobster, the prawns, the octopus. Those ones can also trigger. And it's individualized. We all have our triggers. Some people will tell you, well, when I take pineapple, I tend to itch. So these are some of them. Then we have Scylla. Scylla, I think you joined us 2 weeks ago. So we are beginning to have very, punctual, very people, who join us almost every other time on Sat. So Scylla was also part. Scylla, I want to ask, what role does insect bite play in causing body itches? So Scylla, very interesting one. So what happened is there's a condition we call papular urticaria. It tends to be very common in kids, especially kids who have very sensitive skin. Now, what they do is once you have the bite, it leads to a cascade of events, and eventually leads to all these release of these chemical mediators and stuff. And they tend to cause some of these. Some of the chemicals that they release, or these mediators, histamine is definitely part. And that's the reason why once you take an antihistamine, so what it's doing is it binds to the histamine and relieves you from all the itchiness associated with it. So that's very common. Then Wilson, I remember Wilson 2 weeks ago. So Wilson, yes, from the UK. Also wants to know, so can internal diseases cause itching without visible skin changes? And when should someone see a doctor for persistent itching? So yes, Wilson, thank you so much. First of all, yes, you can have an internal disease causing, whether malignancy, whether, blockage, the bile duct blockage, or, so you can have these causing it as well. And sometimes you don't have any obvious skin changes. So sometimes you could be there, and the only symptom that you have is the itchiness. There's no obvious changes. There's no rash there. There's no reddening, nothing. And that's the reason why once this happens, so we say if you are using all these antihistamines, you are still not getting a relief. And we need to stress the pathway can also change. Not every pathway will lead to histamine release. And that's the reason why sometimes you take an antihistamine, but the itching is still worse. You're not getting better. So definitely, yes. And that's the reason why we need to investigate. So if you have persistent itching for, when we say persistent, when we say chronic pruritus, so more than 6 weeks, and you've taken all these, you're not getting any, there's no obvious rash, and it's even worse when it's happening in an elderly. You need to see a doctor. Very important. Kofi Bai is also asking, what is the relationship between itching and infections like scabies or fungal infection? So, yes, scabies, that's the hallmark. So, nocturnal pruritus. So, when it comes to scabies, yes, definitely some people experience it, and it's worse at night. Fungal infections, yes, also some people also experience itchiness. But the difference is sometimes the scabiness or the itchiness associated with scabies is very intense, very severe. Way back with some people, it keeps you at night. You're not sleeping. Very, very itchy. Wilson is back. Can certain medications cause itching as a side effect? Yes, a big yes. Alongside, can allergies cause body itching? Yes, definitely. Especially with the Wilson hives. So some people will tell you, I had a patient who had visited abroad, who went to a dinner, had some meal. So typically, she knows herself. She has these allergies. Anytime it comes, she takes her antihistamine. She's fine. But unfortunately, that day, initially it was just itchiness around the lips. Then she took her antihistamine as always. Unfortunately, it wasn't getting any better. So somewhere about 2-3 hours later, she realized she had difficulty breathing, and that's one thing that we don't want to happen. So sometimes, yes, an allergic reaction, it starts as just a body itching, then it can progress to now, airway narrowing. And at that point, yes, it's an emergency. If not, then not the patient when it comes to, breathing, there's a problem. So yes, it can progress from a simple, body itching to now difficulty breathing. So definitely you need to. Wilson is also asking, if so, which allergens are most likely? So the allergens are a lot. We can start from the foods. So when it comes to eczema, I'm going to mention these 6 foods that are common triggers or allergens. The first one, cow milk or dairy product. That's the first one, especially in kids. Secondly, people, when it comes to egg, especially the white part. Number 3, nuts. Very important. Whether it's a peanut butter, whether it's a spread, whether it's a soup. Very important, nut. Number 4 is wheat. Number 5, seafood. So the seafoods are the shrimps, the lobster, the octopus, the prawns. And the last one is the soya bean, soya milk. So these are the common, allergens when it comes to this. But as I said, everybody it's more individualized. Some people can tell you, when I take pineapple, that's my allergen. But the common ones, especially in our setups, is what we call house dust mite. So you don't see them. They are usually on the floor, in the carpet, very stuffy areas and stuff. So these are some of the allergens. Hannah is asking, how does histamine affect the itchiness in the body? So this is what happens. If you are experiencing urticaria, so there's what we call the mast cell, MAST, mast cell. So the mast cells, what they do is, so you need a trigger. Once the trigger, it's been, or the mast cell is exposed to a trigger, it leads to what we call degranulation. So basically, what is happening is, it leads to opening of your mast cell. So initially, you have a very intact cell, but now you have some holes, around the cell. So within the cell, you have histamine. Not only histamine, you have interleukin, interleukin 2, interleukin 6. We also have, sometimes you have even cytokines. So all these mediators are inside the mast cell, and it leads to the release of histamine. So histamine is being released from the mast cell into your bloodstream. Then that is what causes all this. So apart from the itchiness, sometimes you realize, especially when it comes to the wheals and hives, you realize now water starts, or sips or leave the blood vessels onto your skin. And that's what we see as the wheals and the hives, because then you need a certain pressure, to push the water up there. So yes, that's how this comes about. And that's the reason why when you take an antihistamine, it calms it down. You can also take a mast cell stabilizer. What they do is, even when you are exposed to the trigger, you realize that you are not releasing, or there's no degranulation. And that's how these works. Phelps is back. Can you explain the difference between itching caused by infections like scabies, fungal infections, and itching caused by other skin conditions? Phelps, you are being biased. You mentioned some infections, then the other ones you generalize them. So thank you so much. What the difference is, the history, basically. You need a history, because the presentation is just, so first of all, what is causing the itchiness? You can have itchiness with or without a rash. And that's what Wilson was asking. So if you have somebody who is presenting or who has persistent itching without a rash, and especially if it's an elderly, you need to investigate. You are thinking of malignancy, or you are thinking of cancer, and it is very important. So first of all, the history is very important. If it's an infective cause, if it's a fungal cause, yes, there's an obvious rash there. There are some scaliness, or there is some, especially with the edges. You see these sometimes raised edges. It could be hypo, it could be hyper. So you can have the dark patches. You can also have these light patches as well. So the history is very important. When we are suspecting scabies, I mean the itchiness is worse at night, and sometimes you can have one or two people home who is also experiencing a similar thing. So yes, the cause is very important. That one will tell you exactly what to do. Wilson is back. How do dermatologists diagnose the root cause of unexplained itching when there are no visible? So it's very simple, Wilson. First of all, you want to know the age of the patient. So the age of the patient gives you an idea the likely triggers, and that's very important. These days, money is very, it's hard to come by. So you don't just go to the market and fish. You don't just write all sort of, lab requests for the patient. No. So it has to be targeted. So you take into consideration the age of the patient, very important. Now, based on that age, then that one will tell you exactly the labs to request. For instance, if it's a young person, you are thinking of hepatitis B, you are thinking of vitro or HIV, you are thinking of H. pylori infection, you are thinking of an ESR, you are thinking of is there any autoimmune condition. So this is how you think about it. If it's an elderly, in addition to all this, you're also interested in checking the liver function test. You are interested in testing the kidney function as well. Then also ESR in general, we are thinking of something, inflammatory or something, long, term cause of it. So it all depends on the age of the patient, very important. Then we are here. Wilson is back again. Thank you so much, Wilson. He says, how can psychological factors such as stress or anxiety exacerbate itching? And what are some of the effective coping strategies? And what is the connection? Wilson, you are definitely an examiner. What is the connection between certain medication and itching? And how can patient differentiate between side effects and allergic reactions? So very simple. So when you are thinking of side effects, the most important thing is, so the history is very important. So the classic history of doc, I was okay until my physician said my BP is still high, so he added this new medication. I don't know what it is, but anytime I take, I realize my eyes get swollen sometimes, or my lips starts getting swollen, and I also experience these itchiness and stuff. Then you probe further. Oh, doc, I was fine until just 2 days ago. I started taking this multivitamin. Oh, I was fine until just about 5, or just yesterday, I started taking this antibiotic. So right from then, definitely, or you need to rule out this drug-induced or drug cause of it, So that's very important. Thank you so much. If you just joined us, this is the Derma Dialogue. We are here every Saturday, 6:30 p.m. and we talk about skin. This is the only radio program dedicated to skin complaints, skin care. We want to be sure, or we want to hear from you. We want to know all of your complaints when it comes to skin. Next week, I think you can't miss next week. Next week, we are discussing hair loss. Hair loss, whether it's happening in men, whether in women. We can even do we can ask, we see hair loss when it comes to hair loss. Is it more common in men or more common in women? Why are we losing our hair? Why the baldness? How do we differentiate baldness from hair loss from, let's say, an infection or following an infection? And why have I used minoxidil? I have used Regain. For all this number of years, I'm still not getting my hair back. Or why am I losing hair even when I'm using my minoxidil? So what are some of the causes, or some of the, when it comes to treatment failure, when it comes to hair loss? So join us next week as we discuss hair loss, common causes in men and women, and what to do. If you have any skin condition, if you are itching, you can also call 0256 06 3807. So 0256 06 3807. You can call for a consult if you are itching, chronic pruritus or aquagenic pruritus, you have hives, you have wales, call and let's book an appointment. My name is Dr. Kofi Ansah-Brifo, and up next on ZFM is Reggae Cafe. Thank you for listening.